And hello to everybody. Thank you for giving me this opportunity to come and speak to you all. I'm the team manager for the long-term neurological conditions services. We're based in Sheffield, and we're part of Sheffield Health and Social Care NHS Foundation Trust. I'm speaking on behalf of a working group. I'm not quite sure if any of my colleagues have made it onto the call this morning, but certainly if they have, then I'm inviting them to participate. If there's anything that they feel that I've missed, then I'm very welcome for them to join in. What I wanted to do today was use the time to really just to give you kind of honest, warts and all kind of description of what we as a group have been through as part of the Enjoying Work Collaborative, sort of highlighting some of our successes, some of our challenges, and hopefully sharing a few reflections on some of the things that we've been through. So could I have the next slide, please? Thanks. So in terms of our service, we've got 3 clinical teams and an administrative and a referral management team that supports those clinical teams. We're a community service. We see people in their own homes, or we do have an outpatient facility to see people in. We see people in their places of work. We see people out in different types of community settings. And we're there to meet the needs of adults living with the challenges that having a long-term neurological condition causes. And we're there really to help people be able to participate in society and find meaning in their lives, despite the sort of health problems that they're experiencing. Next slide, please. Okay, so to talk about beginning in terms of engaging that whole staff group. So we've got about 40 staff within the long-term neurological conditions service. Initially, we looked at developing a working group for the Enjoyment at Work Collaborative. We already had a working group existed that was looking at supporting the health and well-being of our staff. And that group already had representation from all 3 clinical teams and our administrative team. So it was decided that in consultation with that group, it was decided that actually that group would take a lead on behalf of the whole staff group on this project work. We had set days and times for meeting for that working group. And we utilised MS Teams as a way of being able to meet. There was quite a lot of challenges in terms of that group meeting, in terms of people's capacity to be able to give their time to the working group. And we did take a very flexible approach in terms of people being able to make it and participate in every meeting. We initially started as a meeting every 2 weeks, but then moved that to a weekly meeting, really to try and maximise the momentum with what we could achieve with our time. We tried to make one of those meetings ones that we encouraged people to really try and prioritise and make the most important. And then the one meeting between was one which was a bit more of a drop-in session, really just to catch up with where we were at and how things were progressing. So that working group initially went through the process of developing some potential areas of change and things that we could do that might improve people's enjoyment at work. We took those ideas to the whole team. So we have a monthly whole team governance meeting, which is done over MS Teams. So we took some of those ideas there. We also encouraged staff to add any additional ideas that they thought might be really useful. And then we used a consensus method with the team. We started that consensus method off in a whole team meeting to get some idea of prioritizing those change ideas and what the whole team wanted the working group to focus in on work on initially. And I guess as part of that exercise, we started to get some sort of staff frustrations with the improvement work, really, and some challenges around engagement of the whole staff group. There was sort of a level of underlying cynicism there for some people about whose responsibility is it to create enjoyment at work, and that a sense for many staff that actually the things that we were likely to be able to influence as part of our work were tinkering at the edges, and that some of them, the big things that were really making the biggest impact on their enjoyment at work were infrastructural and organizational issues that they kind of felt not empowered through the enjoyment at work to really impact on. Things like IT systems that were particularly helpful, electronic patient record systems where we didn't really get the kind of support to make the most of using them that we'd want, and a host of other issues. Do you want to move on, please, for the next slide? Okay, so team autonomy and diversity. So as I said at the beginning, we've got 3 clinical teams and an administrative team, and we kind of quickly discovered as we tried to implement some change ideas that actually we weren't going to be able to succeed with one size fits all. And so we gave autonomy to each of those teams to actually implement the change ideas in ways that they thought was going to be most successful for their particular team. And so the representatives on the working group for each of the teams did a lot of work going back to their teams and doing some consultation work with them about how a particular change idea was going to be implemented within their team. Next slide, please. And then also we were needing to be very flexible around the pilots and how we delivered the pilots. So there were some of our pilots where all staff had the opportunity to participate in the pilot, and then others where a much more restricted and limited number of staff were able to sort of try that change idea out. A lot of that really was to do with the financial implications of implementation. So where there were things that were perhaps going to have cost implications, then we needed to have a very limited pilot. So example of that, we were looking at developing walking meetings, and because of the fact that we're currently working quite remotely, a lot of those walking meetings were going to need to be accessed via a work smartphone, and there was a need to increase mobile phone data allowances in order to be able for people to be able to participate in those walking meetings via their mobile phones. So we had a small number of 5 or 6 staff who we increased their mobile data allowance for as a sort of more limited pilot. Again, we had a change idea which about staff having access to standing desks. And again, because of the costs of that, we started with just 2 standing desks. And we had to limit because of that, the number of staff that were able to experience that particular pilot. Okay, next slide, please. Okay, so evaluating the impact of our change ideas. So the working group gave guidance to the teams about how they would go about evaluating whether or not the change idea that they're implemented had the desired impact. But again, some autonomy about how those outcome measures were used and implemented. So there were some slight differences between the teams in terms of the way in which the particular measures they used, or the way where they went about collecting that data. Again, there was quite a lot of challenge around engagement with data collection. People really struggled with prioritizing giving that feedback, and I think part of that was also the kind of this underlying frustration and cynicism about the enjoyment at work having a positive impact, and the feeling really that it was responsibility of the organization to create a work environment that was enjoyable and not really their responsibility. The working group did make data collection as easy as possible, and it was very difficult to kind of identify methods of data collection that weren't too time consuming, but that also had some level of validity. And that was a challenge that we experienced right across all of the different change ideas that we came up with. Communication between the working group and the staff was really important in terms of data collection and engagement with the change ideas, and having a representative from each of the teams on the working group really helped with that, and for them to be a direct link with each of the teams. The pandemic did make that communication much more difficult with the staff working remotely. But despite that, the reps did manage to make inroads in trying to make that link and that relationship with the teams in terms of engagement with the projects, and particularly with data collection. Next slide, please. So this is just an example of data collection. So one of our project ideas was looking at increasing kind of staff flexibility about working outside of core hours. So the idea was that they would be given an allowance, an amount of time each week, which they could take out of their working core hours to do things that were for their health and well-being, and that time could then be paid back outside of the core hours. The working group developed this Excel spreadsheet with a tab for each of the teams, and on each tab, for each week, people were asked to record when they'd utilised that facility. So when they'd taken some time out of their working day to do something for their health and well-being, and paid that back late at some other point during the week outside of their core hours, and asked them to score on a Likert scale 0 to 5 in terms of what impact having had that time out had on their health and well-being. And we had reasonable engagement from the teams in terms of kind of the collecting that, the storage of that data. Next slide, please. And then the Improve Well app survey. Again, this was something that we have kind of really struggled, as the previous speaker was talking about, in terms of supporting staff to be able to record on the survey each week. We've fluctuated in terms of the proportion of staff completing the survey. Probably at its best, we maybe have had about 25% of staff completing the survey in any given week. We've tried different ways of trying to improve that. So we've given staff time in meetings to complete the survey. We've booked time out in staff's diaries to do the survey. We've advertised it in our weekly newsletters. So we've done a host of things to try to support and encourage that kind of engagement with the survey, but that has been a real struggle, and it continues to be a struggle. I guess the other thing we've done is we've fed back the survey results at meetings. And I guess one of the criticisms in those meetings is in terms of the results, how valid they are, because there's such a small proportion of the staff that have completed them in terms of their findings. Next slide, please. Okay, so kind of thinking about some of the things that are kind of out of the control of the team that some have had some impact on our experience of the enjoyment at work collaborative. So I guess one of the positive things is our experience of a senior sponsor within the organisation. So we had an issue around the standing desks and not really having the budget to trial standing desks, get hold of standing desks that we could trial with the staff. We had a conversation with our senior sponsor, who then went to our procurement team, who had conversations with standing desk suppliers. And as a result of that, we did get one supplier that agreed to give us a couple of desks on loan for the trial, which kind of was really positive. And I think, the staff really did feel that the organisation was kind of walking the talk, really, and actually kind of giving it support to the work that we were doing by making this happen. So that was really positive. I guess other things are the impact of the pandemic. So obviously staff have got lives have become more stressful as part of living within the pandemic, and the impact that had on working lives as well, in terms of the service capacity for the work, and the increase in kind of waiting times and bottlenecks within the service, and the need to really prioritize clinical work. And I feel that has been a significant factor, making it more challenging for the staff to kind of engage with the Enjoying Work Collaborative. So most of the change ideas initially identified have been either implemented, or we had to come to the decision that because of the restrictions that the pandemic places on us, that they aren't really realistic or practical change ideas to look at implementing at the moment, and they may need revisiting when pandemic restrictions ease. Next slide, please. So just kind of give you an overview of the different change ideas that we have implemented since starting the collaborative. So there's the flexible working, which is the project that I mentioned earlier on, around people being able to take time out of their working day to do things for their health and well-being. Walking meetings, which I've already touched on, and the standing desks. In terms of the flexible working project, we've reviewed the feedback that we've had from staff around that facility, and it was overwhelmingly positive. So we've actually took that to our sort of service management team, and had agreement from them that actually we're going to go out of the pilot stage for that particular initiative, and that's now been made sort of a standard offer for all staff moving forwards. And the other project that's now left the pilot stage is the standing desks. So again, the two desks that we had overwhelmingly positive evaluation in terms of their impact on people's health and well-being, and so we've actually managed to get hold of some funding from the trust to purchase 8 desks, and we're waiting for delivery of those desks at the moment. So again, that's now gone out of its pilot phase, and access to a standing desk is now a standard offer for our staff. Other projects that are still very much in pilot phases are we've utilised Microsoft Teams communication channel to have a social channel for staff to post kind of social type activity with each other, so posting photographs, giving advice about people have eaten out somewhere, and make recommendations, those types of activities. We've also got a project around green spaces development. So there was some funds available within the trust to look at developing outside spaces for staff around our buildings. And we've got 2 sites, and at both sites, the Enjoyment at Work working group have supported the staff to put forwards applications for developing and improving the outdoor spaces around both sites, and we're currently waiting to find out whether we've been successful at getting funding to take those developments forwards. And then the most recent change idea is we've actually going through quite a lot of change at the moment in terms of our staffing. For various reasons, we've got about a quarter of our staff that will be leaving us either permanently or for a 12-month period over the next few months. So we're aware that we're going to have a whole host of new recruits starting with us. And we've been thinking about the challenges for new recruits starting and feeling part of a team when we're working in a very remote way. A lot of people kind of predominantly working from home, and not having those opportunities to physically meet colleagues. So we've done I don't know if people are familiar with a flinger. So we've done a flinger exercise with all the staff to try and develop ideas about what we might do so that the new recruits can feel welcome and a kind of feel part of a team when they start with us. Next slide, please. Oh, so really just thinking about the legacy of the collaborative. So our intention is that the health and well-being group, that's the core working group for the collaborative work, is going to continue beyond the end of the collaborative, and that it will continue to look at using the methodology that we've developed as part of being involved in the collaborative in the way that we work. And we'll look at dropping the frequency that group meets, so it won't be meeting weekly anymore. And that group does plan to have at least one annual session with the whole team to help start to develop ideas about what further change ideas they want the working group to lead on. And there will be regular opportunities for that working group to keep communication with the whole team around enjoyment at work type activities. So we've got a weekly newsletter, we've got team governance meetings, we've got the MS Team social channel, and we do have some whole team half-day events, and those are all going to be opportunities for us to keep everybody informed of the work that's being done on their behalf around improving their enjoyment at work, and having a conversation with them about what it is that they want that group to be doing. And we also have opportunities to regularly update senior managers around what the improvement at work group is achieving. So we have quarterly performance reviews where it will regularly feature on the agenda for discussion. And hopefully we will also have some opportunities within the organisation to share some of the learning and look at whether we can spread what we've done further within the organisation. So I hope that was a bit of a whistle-stop tour, but yeah, I'm open to any questions.
Thank you, Mark, for sharing that, and I hope those of you who've been listening have found that really useful. If you do have any questions for Mark, can you please pop them in the chat? I'm just mindful of time, and I know that we're due to go into a 10-minute break. But if there are any questions, Mark, are you okay to answer them in